When to use nebulizer for a child?
So nebulizations for children are usually used for most commonest problems like asthma or viral induced wheezing or something we call as under 5 V's with high probability. So when do we use? That is a very important question. And how do you use? That is also an extremely important question. What we have seen is each and every one having a nebulization machine at home, which is absolutely outrightly something that should not be done, because when a child is wheezing and you are giving nebulization to a child, can be salbutamol or levosalbutamol without oxygen, the child can develop something called as reflux bronchospasm. That is, rather than breathing pipes becoming bigger, the breathing pipe can eventually become smaller. That is called as reflex bronchospasm. The reason being, when you are giving nebulization without oxygen, that is humidified oxygen, the nebulization solution as well as the air that is being pushed through is cold air. So this itself can cause reflex bronchospasm, which can be detrimental to the child. At the same time, when you give nebulization without oxygen, there is something called as VQ mismatch, that is breathing pipes which are connected to the balloons, which actually help in oxygen and takes out the carbon dioxide from your body. They start opening up without actually carrying the blood to those particular areas. That is called as VQ mismatch. Again reiterating, areas which are not ventilated now gets ventilated, but the areas which are ventilated now, which have never been perfused, that is no blood flowing through those areas, are not flowing or flowing, then it becomes extremely difficult. So ventilation perfusion mismatch happens. So ventilation is not happening because of the bronchospasm, but perfusion is happening because the receptors have worked there, and that leads to ventilation perfusion mismatch, which eventually leads to child developing significant problems. So if you ask me, can nebulization be safely given at home? No. Where do we give nebulizations? Nebulizations have to be always given in hospital settings, and it has to be always given with oxygen, because humidification of oxygen is extremely important. And most importantly, without humidification, I have already spoken, reflex bronchospasm can happen and ventilation perfusion mismatch can happen. That is, ventilation is not there but perfusion is happening. That can lead to significant ventilation perfusion mismatch, eventually causing a lot of issues. So what are the medications that can be given through nebulizations? There are umpteen number of medications that can be given through nebulizations. Like I have mentioned, the commonest indication to give nebulization is acute exacerbation of wheezing. That is, a child has come to us with severe wheeze and saturations are less than 92. There we definitely use nebulization. Apart from that, we also use other medications to be delivered through the inhalational route to the lungs by nebulization. That is, antibiotics. We have conditions like bronchiectasis, we have conditions like cystic fibrosis, we have conditions where the lungs are damaged, where we deliver these medications through inhalational route. Apart from that, we also have some special medications called as pulmozyme or DNAs, which can deliver that particular medication into the lungs, so that the phlegm that is so thick will start getting a little bit more easier for the child to spit it out, particularly in children with cystic fibrosis. Apart from that, there are some special medications called as prostanil, that is prostaglandin PGI2, which can be given as inhalational route for children who have pulmonary hypertension. So definitely children not only use nebulizations, children can use nebulization in a safer way, but in children who have wheezing or asthma, it is always indicated not to give nebulizations without oxygen, especially at home, so that we can not only prevent complications but also make sure that children do not have a rarer complication called as sudden death because of that.